So, greetings, friends and followers. This is Nurses Talking, and I am Dale Barzy. As always, if you like what you see and hear, subscribe, leave us a comment, let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. Today, I have the very great pleasure of welcoming Misty Carey out of Perth, Australia. Misty, of course, is a nurse. She's an educator. She's a public speaker. She's the founder of Tide Education. And she says she's dedicated to improving healthcare outcomes through education, innovation, and authentic connection. So, welcome, Misty.
Thank you so much, Dale. It's really lovely to be here and with your audience.
Thank you. It's my pleasure to have you. But tell me, first of all, what brought you to nursing?
I have always been a caregiver and I like nurturing and looking after things. So it was a natural step. I enjoyed human biology at school. I might have topped the class, and it was just a natural progression.
So you found your niche very early. You found your
Very early. I've got stick drawings of me saying I want to be a nurse, and it's a little stick
wow.
drawing.
So you had a vision board. You're like
I did. Yeah.
laser focused.
Yeah. 100%.
Okay. All right. So then I have a question. Since you wanted to be a nurse always, when you became a nurse or on your way to becoming a nurse, what challenged you the most?
It's interesting. Um, I actually loved nursing. I've always loved nursing. And if I'm thinking about that question, there hasn't been any challenges that bothered me for my whole career because I guess I'm a bit of a glass half full person, but I must admit, recently, so maybe over the last few years, I've kind of recognized that there is a sort of a balancing of organizational risk and the self-determination of patients and the patient-centered care.
Mm-hmm.
So that's a challenge I find, sort of realizing that organizations have to manage risk, but often their patients are their most risky element, and we've got to
Yes.
allow them to be self-determined and have choice, and that's an interesting challenge that I guess I've noticed recently.
Yeah, yeah, yeah. And I noticed that you have worked in I see you're coming to us from Australia now, but you've worked in different countries.
Yeah. So
And
I did go straight from school into nursing.
mhm.
So think like glass chest drains and mercury thermometers. All right. So that's where I'm placed. But from there, I have traveled. And also, friends were working in a school of nursing and said, "Hey, do you want to come and teach?" I said, "Yeah, I can give that a go." And it turned out I was quite good at that too. So I've traveled. I worked in London at the Cromwell Hospital, which was a really interesting place to work in. I've worked in Africa, in Liberia, on the Mercy ship. I was lucky enough to work on a boat, a very luxurious boat that was owned by Paul Allen, who started Microsoft with Bill
Okay.
Gates. So
Hmm.
we traveled internationally. And then I've also worked quite remotely. So in Australia, I've worked in our remote areas and ended up coming into primary healthcare. So I've worked in general practice as well as our prison clinics. And now I'm in acute nursing, but I've sort of gone from acute to primary health, international, and I did a little bit of time in quality improvement. So learnt sort of policy, strategy. Yeah.
My experience has not been quite as varied as yours, but I have had the good fortune to work in several countries. And one of the things that I did notice is that you're not perceived the same way, nor is your scope of practice the same. And so that's something that I felt that we needed to share, because an illness is an illness is an illness. And I think we kind of like, we need to, um, approach it from one standard thing. So, that was one of the goals of this channel, is why it's a
Mm,
global channel, because I feel like we're nurses and we're perceived differently. I don't think we all know that we're perceived differently in different places, even in the same country, depending on where you are.
absolutely.
So you talked about nursing in prisons and remote areas and some very challenging and some luxurious environments and
Mm,
all of that. So, what would you say then? What experiences shaped your understanding of trauma then? And why
mm,
trauma? And the way people
mm.
respond to stress and stuff like that.
Yeah. I do feel like because of my international experience, as of yours, Dale, and I really loved how you touched on we do need to recognize that core knowledge of nurses. And just because you don't know the systems or how to page the doctor or how something's written up, it doesn't take away from your value as a nurse and a
Exactly.
clinician.
Hmm.
Yeah. And I feel that the more experience people have around you, the more they recognize that.
Yeah.
A person's behavior makes sense in the context of what they've lived through. And so
Hmm.
often a nurse that's had a lot of international experience coming to a small place where maybe the other nurses haven't been as fortunate to travel as much, then they
Yeah.
don't have as many sort of experiences to link things to.
Yes.
So for me, it was very much, I guess, my professional experience as well as my lived experience that made me realize to have that extra vision that perhaps you get when you've been fortunate or unfortunate to have lots of experiences. You know what
Yeah.
I mean?
So, and so, I see that I said earlier that you found it Tide. So
Yeah.
tell me about
Yeah.
Tide. First of all, what does the name mean? And what are you
Yeah.
hoping to get through this?
Well, I actually never meant, sometimes people say I'm never meant to do this or never meant to set this thing up.
Yes.
Same for Tide. So I was in a remote area hospital and I recognized that we needed a different approach to violence.
Hmm.
And, uh, you know, I realized, I guess, that my lived experience helped me see something that wasn't so obvious for many other people in that space. And for me, I was like, guys, this patient isn't violent. They're terrified, you know?
Uh-huh.
Um, but because they're perhaps, my lived experience of trauma and poverty and stuff helped me realize that I could see fear where a lot of people just saw violence because
Aggression. Hmm.
it's fight or flight, isn't it? They're
Yeah.
fighting their way out of fear. I got in touch with the social worker for that area because I was a
Hmm.
student. And I said, what if we counted the code blacks, we call them here, so when security is called in because a patient is considered violent.
Uh-huh.
A security call. What if we counted the security calls? We provided trauma-informed care training, so we taught the nurses what childhood trauma does to people's brains, what repeated trauma does to people's stress responses. And then we do that, and then we measure the code blacks afterwards. And I was just saying, my hypothesis is that they will fall. I said, I'm a bit busy at the moment. I had a full-time job in that quality improvement role, but
Hmm.
I'm just putting that out there. What do you reckon? And she said, that's awesome. I work for an Indigenous medical service. Would you create some training for us? We're looking for trauma-informed de-escalation training. So I muddled that around for a while, and then I thought, oh, trauma-informed de-escalation stands for TIDE. And metaphorically, I want to change the tide in
Hmm.
violence and approaches to violence. So I ran this past an Indigenous friend of mine who's also a traditional owner and very important, sort of respected in her mob, as we call it, for the Indigenous people, her area. And she really liked the idea because often it is Indigenous patients that are having these experiences because they are a highly traumatized,
Mm-hmm.
more traumatized population. So she came into the Tide with me, and that's why I have the beautiful logo. She's an artist as well. And so it all came from there, really.
Also, but I was reading your stuff, and what struck me most about it was your reframing of the question, from what's with you, what's wrong with you, to
Yes.
what happened to you.
Yeah.
Um, and it seemed to me, as I read that, it seemed to me, well, that should have been very obvious.
Yeah.
You know, it's one of those kind of light bulb moments that you think to yourself, that's
Mhm.
been
Yes.
what was going on along? Oh my goodness.
Yes. And it's so powerful, Dale. I'm so glad you
Yes,
picked that up.
yes, it is really powerful because, as you say, it changes the approach completely.
Totally.
Yeah.
And
And
then for me, what I get so excited about is that it not only changes the approach, but it helps you not see your work as so hostile.
yeah, yeah,
So I work in prisons. I work with, high security prisons, but and there's been times where I've had a prisoner that should have been accompanied by an officer, and it just so happens they went to the toilet and came in and they
mhm,
weren't.
mhm.
And they're aggressive, but they're testing me. But when you sit there and you're just seeing them as someone that has had a lot of difficult things happen to them, and what happened to you rather than what's wrong with you in this moment, then it allows for to you stay grounded and for that sort of the language and the posturing and the behavior to wash off you like a duck.
Yeah, yeah,
You're
yeah,
not taking it as like,
yeah,
oh, what's
yeah,
wrong with you? What's wrong with what you're saying to me? It's
yeah,
more, I'm curious about where this is coming
yeah.
from.
Mm.
And so it doesn't land on you.
Yeah, 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 yes, yes, indeed, yes, indeed. And so I have a question. So, what is your big vision for this, though? And the reason I ask that is because um you have touched on something that is a major concern, not just for you, it's worldwide. This
Yeah.
escalation of violence and stuff like that. It's worldwide. So, what is your big vision for Tide?
Thank you for asking that. I did. You might have seen my recent commentary around tipping icebergs. When I was on that boat, we actually went to Antarctica, and I saw an iceberg tip over. So I'm here to tip that perception for everyone's benefit because I've never had anyone go any further than that initial testing me out. And when they
Yeah,
realize that I'm staying in this moment with them and I'm not getting offended by what I see as their signs and symptoms of emotional pain,
yeah,
they calm down. And I've never had anyone in 30 years hit me or take it further than that initial testing phase.
yeah,
And once they've tested me and realized that I'm just curious about what's happened to them and what's driving this behavior, they just they exhale. I hear an escalation and I run to it because it's satisfying, because it's like I get to de-escalate and I connect with someone. It's
hmm,
so much more enjoyable than feeling like that
yeah,
person genuinely
yeah,
wants to harm you.
yeah,
Because of course, it's not a one or the other. It's not sort of safety versus compassion. It's just allowing for that connection. And if they still are, escalated and violent, then you move on to your more sort of
yeah.
control,
Emotive. Mhm.
safety. But 90% of the time, this approach allows for that sort of just, I call them off ramps, just allowing for an off ramp.
Yeah, 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 yeah. I can visualize it right now.
I call it like a backward snakes and ladders. So snakes are sort of like the off ramp, and you
Yeah,
sort of go. And we've got to think about that. Like one of the exercises I do in my training is we talk about something that bothers you, like gets you, really
Mm-hmm,
stirred up.
mm-hmm, mm-hmm.
For me, I don't know if you have those shopping cameras where you have to do all your own self-checkout now. And then if
Yes,
you've
yes.
got anything in your trolley, it'll say, have you got forgotten anything in your trolley? I'm like,
Forgot
oh my
anything,
gosh, I've
yes.
done all the work for you. And now you're going to ask if I've got something in my trolley. And so I talk about something that makes you feel like, "Ugh." Then what
Mm-hmm,
do? You start looking around and,
mm-hmm.
I start sort of putting my hands up and I look gruff. And then I talk about, okay, what in that moment makes you calm down?
Yes.
And we go through that. And often we'll make a beautiful list. And for me, it's even like it's not just the shop assistant coming up and typing in a code and fixing it and walking away. It's her not only doing that, but her also acknowledging the situation. And she'll go,
Yes.
yeah, it's really annoying, isn't it? You're not the only one that this happens to.
Yeah. Yeah.
And then I come down that extra level. And so we'll put all of that up. And then I'll say to the people in the class, how how many of those do our patients or prisoners get to access?
Yeah.
And it's like, oh, they're not getting the off ramps that we access
Yeah.
to come
Yeah.
down.
Yeah.
So for prisoners, I'll give them something like, they've got nothing. So
Yeah.
I'll give them just a, squeeze in between your thumb and your finger really hard. Oh, to save them getting in trouble
Yeah.
and
Yeah.
going into sort of, smaller areas for longer.
Yeah. 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 But it's always good to have having a mechanism to deal with something, no matter how small or insignificant it seems. If you have a mechanism and it works for you, it's all
Yeah.
good. Yeah.
And the amount of control you feel like you have in that moment
Hmm.
is
Yeah.
really, it's more powerful than maybe you think.
Yeah. 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 And so I read that you use virtual reality and AI simulation. So how does this kind of immersive technology um help people to
Yeah.
build confidence and emotional intelligence in
Yeah.
this space?
I'm really excited for where it's at, but also for where it can go with that emotional intelligence. So I'll start where I started. When I was first asked to create that training, there was a comment that stayed with me, and she said, "How will you come back and let us know that the participants are competent?" And then I was at
Ah,
a nursing conference and I came across this VR and AI. And that was my little ding, this could be it. So the package comes from a really lovely collaboration with an organization called Frameless Interactive, and they created it. It's from nurse led, from a nurse being injured,
mhm,
and the debriefing was everyone said it just seemed to come out of nowhere, and that sort of they didn't know how to respond, and it startled them. So the first part, the VR, is sort of going to that startling aspect. So they've got a big range, but because I just do one day, I use parts of it. The
mhm,
part I use is the participants will put on the VR and they are in an ED and they are watching a patient get escalated and they can look around them and you feel like you're in an ED. There's beeping and you can
mhm,
see the other people walking around and there's sounds around you. And so it's very lifelike. And so this is purely just an observation, but they get to watch someone like yelling and screaming and throwing stuff around. And then they get to watch the security come in and take this person down. And then they get to take the goggles off and debrief. And this is a really wonderful way of helping them walk through this in a safe environment. So when they have it for the first time in real life, they're staying in their cognitive brain and they're not going to survival and panic and adrenaline. So that not only helps them react and think more safely in the moment, but it helps them recover better because they haven't been so shocked.
Yeah. Yeah.
Then the AI part is they then put the goggles back on and they choose a scenario from 10 scenarios of someone who's in a frustrated situation. And they have to then choose that. So, like an impatient, a son who's worried about his dad, a mother, a domestic violence patient, and they are frustrated. So they come on and you see their percentage at like 95% frustration. And it's a bit like a walkie-talkie. So they press down and say, "Hi, can I help you?" And this person comes back like, "What do you mean you can help me? I've been waiting here forever."
Yeah. Yeah.
And
Yeah.
they've got to keep pressing down and talking, which we now know is the large language model, but
Yeah.
it's in the form of a patient standing in front of them. And so they've got to use the skills they've learned over the session of really digging down into why this person's being like that rather than being stuck at that sort of surface level. And they watch the percentage come down. And what's lovely about this is you move away from those role plays that for a lot of people are very uncomfortable,
Yeah.
and they get to go into a space by themselves and practice and think about what they want to say. And they'll often come back in and say, "Oh, I got them to 35. Can I have another go?" And they'll go back in and come back. "I got them to five. Ah."
So now we have excitement rather than trepidation. I love it.
Exactly. And I saw this clip on YouTube where they put in Mexico, bus drivers, they had a problem that bus drivers were driving too close to people on bikes on the road.
Yeah.
And so it was literally a 30-second exercise. They put bus drivers on exercise bikes on the side of the road and made them pedal, and then with someone else drove the bus really close to them. And they're like, "Whoa." So what I'm excited about VR is giving those highly sort of
Yeah.
experiential
Yeah.
opportunities to be in the other's
In the
shoes.
other, yeah.
That's only 30 seconds, but now those bus drivers, it's in their head. They know what that feels like. So
Yeah.
they just allow that extra foot now.
Yeah. Yeah. Awesome. 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 So I want to switch just a little bit because we talk a lot about Tide and not a lot about
Yeah.
Misty. But so one of the things we're talking about a lot, and one of the things I see people complaining or addressing or attempting to address a lot is things like burnout and self-care and stuff like that.
Yeah.
So I want to know what does self-care mean to you, Misty, and what do you do to take care of you?
Hmm. So in my 2 years of moving from instinct to research and understanding, I realized that my instinct came from my own childhood trauma.
Mm-hmm.
And then what I learnt in this is that often with childhood trauma or trauma, self-care is complicated because we don't feel like we deserve it.
Mm-hmm.
So that's been a really big understanding for me. So I'm hopeless at self-care, as probably many nurses are. We are in
Mm-hmm.
this caring profession. Research shows that nurses do have a more likely chance of having some traumas in their background because it's what helps them have empathy and
Yes. Yes.
understanding. So for me, self-care is tricky. Um, and it also takes a bit of time. Like you need to have time and and you're always told like prioritize the time, but if it's very hard. So, but I guess what I get excited about with flipping psychological safety or psychosocial safety and what I get excited about is almost preventing the settings that create that
Mm-hmm.
need for
Mm-hmm.
self-care.
Mm-hmm. Yeah.
And because I see patients as potentially, like what's happened to you rather than what's wrong with you, I feel I walk away with less to recover from.
Yeah, yeah,
Um, you know what I mean?
yeah, yeah, I get it.
Mm. But also, I'm a big advocate for improving systems and changing things so that nurses don't feel like they have to self-care so much and that their settings provide opportunities for enrichment and purpose and value. And I'd really love to see, I went to a summit recently where a doctor talked about how they had dedicated thinking time in a shift to just reflect on what's happening, reflect on what could be better, not from what they could be doing better, but just as a team, like instead of having to just knee-jerk reaction to everything. And I thought, some self-care would just be around giving nurses more agency, giving them real satisfaction in their work, giving them the reins on innovation, giving them thinking time. I think that so much of that would negate the need for self-care because they're getting enriched at work rather than drained.
Mm-hmm, 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 mm-hmm. Enriched rather than drained. That's huge.
Don't you think?
That's quite a vision. That's quite a vision in the South. And that would be so, I want to say ideal, but maybe even more than that. Ideal understates it really. But that would be so cool.
You think?
Just because you know what, instead of, I mean, so many nurses talk about crying in their car and stuff like that.
Yeah.
And what would switch right there is, I want to get to work half an hour early. I can't wait to get to work.
Because it's satisfying. It's a bit like,
Hmm.
kids. You can't make a kid practice something that they're not good at or they don't
Yeah,
enjoy. But as
yeah,
soon as they're good at it, enjoy it, or as soon as they get that positive feedback loop, you can't stop them from it.
yeah, 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 yeah. So I have one last question, Misty, and I think I can see how important this subject of trauma-informed care is to you. So I wanted to, if you could have every healthcare worker, if you could leave every healthcare worker with one mindset shift about safety, what would you tell
Mm.
them? What would you want them to remember?
That being afraid puts you in more danger. You can ensure that you're safe and you can ensure that, I work in prisons with kids. We have to make sure we can't even have pens lying around. But if
Yeah.
you look around your setting and you realize that there's nothing that's going to harm you, that then if you approach that with curiosity rather than fear, you're generally going to be safer. It's a bit like horses, like if you approach a horse sort of, oh, or a dog, oh,
And
then the
yeah, I
dog's
was
going to be
about
like,
to.
"Arr."
Yeah, yeah, yeah,
But if
yeah,
you go in open, calm, then genuinely they're going to stay calmer. So my yeah, last point would be that while staying safe, you you can actually keep yourself safer.
you can
And
keep it.
I
Yeah.
do feel that this tension of organizational risk has actually created more fear than is there.
That needs to be.
Um, and lean into lived experience. So there's a lovely quote, and I'm not going to get it exactly right, but it's around suffering teaches lessons no degree can. And we should never underestimate the wisdom and the value of people with lived experience. So be
Yeah.
curious. Be
Be
curious from this
curious.
person that maybe has got marks all over them because they're an IV drug user. Don't be scared of them. They
Yeah.
might, if you connect with them, it's amazing what they can give.
Yeah.
I work in prisons with women and they're actually many of them are just there for their trauma and they're beautiful souls. I was waiting to go into one of the offices to distribute medication, and I was by myself, which you're not meant to be. And one of the prisoners said, "Don't worry, miss. Don't be scared, miss. We'll look after you."
Yeah. And
So
there you have
you'd be
it.
surprised. You'd be surprised where you'll find humanity
Yeah.
if you are open to it.
Yeah, 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 yeah. And I'm guessing in many of those instances, that what you just said there about her saying, "Don't be scared," just brought to mind. Perhaps much of the time, a person in that situation is just looking for a way to express their own humanity sometimes and to connect with you on that level.
Mm.
Yeah, yeah,
It's looking at the person with absolutely no judgment.
yeah, yeah,
And nothing will teach you that except your perception.
yeah, yeah.
And it's either through lived experience or it's through being curious and open to each person and realizing that they're just a human like
Human.
you.
Yeah, yeah, yeah. On that note, Misty, thank you so very much. This has been such a lovely, eye-opening, interesting conversation. Thank you so much.
No worries, Dal. I would have actually loved to chat and find out more about you, but anyway,
We can do that again. We
we
can
can do
do
it
that
again.
again.
Thank you. It's
Well,
been
thank
lovely.
you.
And thank you to all your listeners and I'm passionate about nurses and nursing, so keep up what you're doing.
I'll keep trying. I'll keep trying.
Thanks, Dal.